Hi, I'm Maya.
And I'm Kate, and we just completed a year in practicum through the 2024 and 2025 school year. We're here to really just talk about our experiences as well as giving any insight that we feel would be useful to future practicum students.
So at the beginning of practicum, you're given the option to shadow nurses at Seton with the class or immediately go to a site of your choice.
For me, I chose to go to Seton, and I felt like that was a really nice way to get an onboarding process. You really get a feel for what, the healthcare field is like. It's really easy and you can just kind of flow into it. It really teaches you to advocate for yourself in the medical setting. You learn how to talk to people that would probably you would first not be comfortable talking to. It's also a great place to go if you don't have any connections or anything in the healthcare field that it's a great place to go just for practicum to first start out. However, I will say towards the end I felt like the experience was a bit redundant for me. I was really interested in the procedural type of healthcare, or that side of healthcare. And so I really started to get tired of it because a lot of it was just following around a nurse to go to med-surg rooms and check up on patients who had already been operated on and really just watch them chart. It didn't really pique my interest personally, but I really do feel like it helped me get accustomed to the medical field.
Okay, and I chose to go directly to my site early, and that was nice because it allowed me to change my site more often. I got to go to more sites throughout the year, but I feel like I missed a very specific shadowing experience that would let me see just more of everything, because I went into very specialized sites, so I didn't get to see anything that nurses would do, which I kind of wish I had seen. And then so reaching out to sites, what I did is I would either call, email, or just plain show up to the site, and I would introduce myself and then explain what practicum is and what we did, and then what days I would need to go and what times. And more often than not, it worked out really well. They were all yeah, sure. And I would probably go, it would take a week or so.
So for me, I have, healthcare connections. And so I feel like it's really important that if you do possess those healthcare connections, for example, my dad's a CRNA, so I was easily able to say, hey, can I come with you to work and shadow? And, of course he said yes, and he was happy to have me there. And so it was really great to, have access to such a valuable profession and to be able to see that side, because it's a little bit more difficult to access those positions, from a, outside perspective like Maya. However, I mean, of course it does work out, but it's just easier, to use any sort of personal connections. But that was really my thing. And then also I would, bounce off of his connections, because he was obviously friends with people in the healthcare field. So I would really just talk to them, and they would, be happy to help me and let me shadow, just because, they knew me, they knew my dad, it was a really easy process. So for that, I shadowed with, obviously I started out with the Seton nurses, and I obviously shadowed my dad, who was a CRNA, but I also got to shadow oculoplastic surgeons, particularly in their office, which was really cool. And I really don't think I would have had that experience had I not used those connections.
I jumped around a lot with my sites, and I guess I changed sites about every 6 to 9 weeks. So I went to an orthodontist, a vet, a fertility specialist, a physical therapist, and a chiropractor. And yeah, so I changed around a lot and got to see a bunch of different things. I really love jumping around, especially because this opportunity gave me so many chances to explore so many different fields of medicine, which I might not have been able to get a lot later. And with my experience, every doctor that I shadowed really loved having me there and teaching me. They really loved what they did, and they really were excited to show me. I was really hesitant to shadow a vet because I knew that's not something I was very interested in, but Ms. Dumont really encouraged it, and I think it ended up being very rewarding because I got to see a lot more. I got to stand right next to the surgeons during surgery and stuff. But I think my favorite experience was fertility, just because I got to see how rewarding and the patient interactions and stuff like that, and it really pushed me to go into fertility in the future.
I had a very similar, obviously, but also different experience. I really enjoyed, practicum. I really liked how much it allowed me to see, and I found it to be a really incredible and valuable experience. And what was so nice about it is that you can really make it your own. You really don't, there's not really one path to take. It's very flexible, and you can choose where you want to go, and there's just so much potential in practicum. So however, I chose to take the structured path and go to Seton, which I got to see a lot of the work the nurses did for various fields in the med surg. So things like psychiatric or cardiovascular. This is like where after patients were operated on, this is where we go to recovery. And so I did really think that this was a great way to start out, but I just really was not. I was really more interested in watching the surgical procedures, which is why I particularly enjoyed my experience with my site. However, if you are interested in like the nursing side of healthcare, then I would definitely recommend going to Seton. So like I said, I had shadowed my dad, who was a CRNA, and it was really amazing because I got to watch all sorts of procedures. So I would really highly recommend shadowing CRNA if you're interested in surgery, but not really interested in, or not sure what you are interested in yet, because you really just get to like watch so many different things and meet so many different people. I got to watch, it was crazy how many things there was to watch. Like I watched orthopedics, oculoplastics, gastrointestinal, fertility, OBGYN, urology, ophthalmology, otolaryngology, and general surgery. And I even got to watch a Da Vinci machine, which was very cool to see. So there was just so much to see and so much to learn. And I really, through that experience, I learned that I'm particularly interested also in fertility, but also in oculoplastics. So having that exposure just like to those personalities that go into those fields and to the content of each field, it was like really, really helpful to narrow down what interested me. And I just really think that first-hand experience is truly so incredible, as it gives you insight into the reality of that field.
Okay, so we were thinking of some tips that we had, and my first one was don't be afraid of rejection when you're reaching out. Don't take it personally. In my experience, they'll take you more often than not. So just any sort of reaching out would probably work. And then you should really study up on the area before you go to shadow, because in my experience, they ask you questions while you're shadowing, and you don't want to seem like you don't know anything about it. And then, so just present yourself in a professional manner, show up on time, and be nice, be sweet, and be smart.
Yeah, for sure. And like I was saying earlier, you should definitely utilize those personal connections that you have in the medical field. It really does give you a world of help. So, parents, family members, family friends, even. These are, in my opinion, I think the best experiences that you're going to be able to have, because you gain entry into these fields that are otherwise very difficult to reach. And as well, I would also recommend really learning your limitations. There are definitely situations that you could be put in that are very overwhelming, and in some cases, cause you to faint. And while it may seem awkward to, excuse yourself from the procedure at hand, or to kind of, just walk out, it's infinitely better to step away from a situation rather than to lose control and potentially injure yourself. All in all, we have really enjoyed our time in practicum, as its capacity to be customized to the individual's healthcare interests makes it an incredible opportunity for learning beyond the classroom.
Thank you.
Thank you.